listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, and today we're joined by Debi Boyle, an oncology clinical nurse specialist with Advanced Oncology Nursing Resources in Huntington Beach, California, and author of the recently published book, Caregivers Companion, who's here to share how nurses can support caregivers, safe handling and precautions for in the home, and misconceptions about the caregiver's role. Thanks for joining me, Debi.
Thank you for having me, Steph.
So to kick off our conversation today, I just want to start in with some questions. And how would you define a caregiver?
Well, the Institute for Patient and Family-Centered Care defines a caregiver as two or more people who are related in any way. That could be biologically, legally, emotionally, and currently in the United States, globally, there are about 44 million unpaid lay caregivers who really are providing the bulk of home care in the United States. So one of the important things to acknowledge up front is that nurses and doctors are not the major providers of health care in the U.S. It's the lay caregivers who are doing the majority of the work in the home 24/7. So they are a very big population. And that number of 44 million is probably on the low end because it's so hard to quantify how many people are providing care, especially when you think of different definitions of caregiver. There may be the primary caregiver, it may be a spouse, a daughter, or whatever. And there may also be secondary caregivers, those who are supporting the primary caregiver or doing some of the other aspects of home care rather than being the primary one who is rendering the direct care in the home.
That's a lot of caregivers.
Right.
And that's a lot of education that needs to be done as well for those lay caregivers that we experience every day with our patient populations. The next question that I have for you is, what is expected of caregivers and what are some of the biggest dilemmas that they face?
Well, when you think of it, either if somebody is in the hospital or in a physician's office or clinic or whatever, really, we just expect that these lay people are going to know what to do in the home on their own with really no direct link to us outside of the home setting. Really, overnight, in many instances, they are expected to be the nurse, to be the physician, to be the social worker, the pharmacist, physical therapist, financial care. All these roles are thrust on the family almost overnight with no ongoing formal teaching of how to deliver these aspects of care that we expect of them. And in many instances, because this is something they're not prepared for, or an illness, and I must say, and the book is not just for cancer, for any family caregiver with any range of illnesses, but we're asking them to take on these roles on a platform of anxiety, worry, fear in some way they're going to hurt their loved one because they're unsure of what to do. We usually aren't helping them with, when to call for help, what is an emergent situation. Many times, they're given a cursory 10-minute discussion about, here's your medications, he needs to get up and sit by the bed, and a brief overview of what we're expecting of them with no lifeline, no ongoing contact. And so they're worried, they're scared. And the other part of all this, I think, also is they don't ask for help or they don't tell us that they are struggling And I think many times because they're not speaking up about this, we assume all is well. So it's an expectation that's thrust on them with very little teaching and help and a discourse back and forth, questions and answers, not just once, but multiple times to help them take on these new roles.
I think that just as you said, the expectations that are put on these caregivers are extraordinary, and we really want them to be an extension almost of the healthcare system, but that's not what they originally thought they were going to do or signed up for. So in these expectations that we put on them, I can imagine that you mentioned several things that they deal with, fear and the anxiety of it, but that these expectations also put a large strain and burden on these caregivers as well.
Yeah, well, Steph, I know I learn best by making analogies to things that we know well. And so think for a minute how we help new parents get ready to welcome a child into the family. There's birthing classes, there's education. And it's not just a one-time deal. These are multiple sessions to help them prepare for how their family is going to change. When you take a new job, you don't just start off and all your coworkers assume you know what you're going to be doing. There's an orientation. You may be buddied with someone that's going to help you take on the new aspects of this role. When you're a teenager, when you want to get your driver's license, you have to go through training. And yet, as a caregiver, in a very, very critical scenario at home where they are rendering the majority of the care, we just expect that they're going to know how to do it. Now, I must say there are some programs that are evolving in the United States that are addressing this gap, but this is not the norm, that family caregivers are helped with this education and training before they are left alone on their own in the home with a loved one that they are providing the nursing and medical care to.
Right. That's an excellent way to explain what we do and how in our country we do have training for all of those different examples that you had. So what are some of the things that you have seen that we as the medical professional kind of assume about those caregivers before we send them out on their way?
One of the things I really stress in the book is that the family needs to really connect with the nurse, again, if it's in the office, in the hospital, and develop a partnership with them. And I think we need to give them the message that, again, because they're learning in this context of a lot of angst, you're not going to understand what I've told you with just one go around. I want you to ask me when things are not clear, and it's okay to ask questions. In fact, I expect you to ask me again if that's not clear. And so when we even think of things like safe handling procedures in the home or adherence issues with all the new oral anti-neoplastics that we are given, and say, we're going to have to go over this repeatedly. Don't feel that when you have to ask again that this is something out of the ordinary. We expect you to have questions. And I think that the other thing is the reinforcement of what we are teaching oftentimes needs to be in different formats. So you may verbally sit down or have the time to discuss something, but it always helps to have something in writing or a format or a disc or some sort of an email blog or whatever that you can refer them to so that they can have that teaching reinforced over time, because they're constantly worried that they're not going to get it or they're not going to get it right on the first time, and somehow they may harm their loved one inadvertently. So the reinforcement of any and all teaching and the acknowledgement that one time isn't enough is so critical. In cancer care specifically, so much of our care interventions are in oral format. I think the other way to phrase this issue to family members is not to say, are you and your husband having problems with taking your immunotherapy or chemotherapy pills, but rather to say, what problems are you having, which normalizes the fact that, yes, there's going to be confusion and there's going to be times in which you worry, especially in the hospital. I often say to nurses, just take time in one of your days and think about how many prescriptions you give to somebody who you're discharging from the hospital. And it's probably not unusual that there may be 6 medications that they have to get filled at the pharmacy. And that most likely is not even addressing those they're taking for other chronic illnesses that they're having. And we know that when you ask someone to take more than 4 medications on a routine basis, and this is confirmed through some large VA studies, anytime there's more than 4 medications, you must assume that at least one of them isn't being taken on the schedule or in a way in which you've asked them to do that. So medications alone are an issue that the families really worry about. And especially if it's an acute illness and they're just home, let's say from the hospital, that alone, never mind knowing how to move them from the bed to the chair or to turn them on their side or make sure the colostomy pouch is fitted right. The medications alone are a huge, huge source of angst for the caregivers. And on top of that, remember that these caregivers may have to work or work part-time or whatever. So they've got the stress of trying to be the breadwinner and get everything set up in home. So maybe the sister-in-law could come and stay with your husband for the morning while you work or whatever. So the workload and what is expected of them, again, in this context of worry, can really be overwhelming. One of the things I have heard of that I think is a great idea, in one large, actually it was an oncology office that I visited, and what they do is when somebody is a new patient and they come in with their family member, what they are told is they should identify what they call a medication partner. So it may not be the primary caregiver, it may be the adult daughter or whoever, but that one family member's job is to assist with the medication, taking it when they're supposed to, getting it refilled, understanding if there's any titration, just to oversee what's going on with their medications. I think that's great idea, and I think that's something that we could initiate regardless, again, of what setting we're in the ambulatory domain.
Those are all really great points, Debi. When you were talking about the teaching and the reinforcement of the teaching, and all I could think of was, going back even to nursing school, see one, do one, teach one, and, that we all do learn very differently, and how it would, it's really important that we find out how the caregiver learns information. And I'm sure you have seen, as many of the nurses that, when healthcare professionals that will be listening to this have seen, that shock, the time frame of the new diagnosis, or you mean you're sending them home and I have to take care of them.
Yeah, I use a lot of stories in the book from myself, having been a caregiver, as well as from exemplars wearing my nurse's hat. And I had an aha moment myself specific to this issue of medications. And I remember I was on the phone talking to the oncologist, my husband's oncologist, and he was giving me advice if I how to titrate, I think, his nausea medicine or what to do next. And I literally walked out of the bathroom where all the pills were all assembled on the top of the counter. And I totally blanked. And I'm like, I literally could not remember what he just told me. And I said to myself, well, here I am, an oncology nurse, and I'm struggling and I'm having trouble. Can you imagine a lay person who has no background and nothing to rely on? And how can we expect them to get it and just proceed? So that really was an eye-opener for me and reinforced my concern that I've had for many years about families being unknown soldiers. Rarely will they say, I'm struggling. Rarely will they say, I need help. And because they're not talking or they're not asking, we often assume they're doing okay, and that many times is not the case.
Well, thank you for that. That's it. I think it is very important for us as medical professionals and nurses, when we are dealing with these patients and families, and we have that moment that we're on their side of things and that we take for granted in being on the medical side of things, and how it really sparks us to do better for our patients and their families. So can you tell me a little bit more about your new book, Caregiver's Companion?
Steph, this is a labor of love over, really, I'm not exaggerating, decades. I've been throwing ideas into a file folder and wanting to write something for family caregivers. Ever since my very early days, I've always been very sensitive to unacknowledged needs of the family by the patient's side. And over the years, I've been keeping up with the literature and looking for resources, something that I could give to family caregivers, sort of like, not the best analogy, but sort of like what to expect when you're expecting. And I never could find anything. There were memoirs of people's experiences as a caregiver, but nothing to map out what a family caregiver can expect from their emotions, from what can help them navigate these very murky waters of healthcare, give them some very practical advice about what might help. And so I've finally found the time to pull it together. And I got my books yesterday in the mail, so I got to hold them in my hot little hand. So I was so happy. But I also, what I've done in the book also is give them little exercises in each section of the book. So to individualize, let's say when I'm talking about one of the most difficult things is finding meaning as to why this difficult illness has happened to a loved one. And so at the end of that chapter, I put in exercises to help them look at, really where is their anger, is there guilt, where is that coming from? And is there a way to reframe that into something that can help them in their caregiver's journey? And really, as I mentioned before, a lot of it is normalizing what they're feeling. It's, patting them on the back and saying, it's okay. There are others going through this like you. And you're having a normal response to an abnormal situation is often the way I phrase it. And I repeatedly mention in the book that nurses are your best resources. Nurses are great at putting puzzles together and making these critical linkages for them. And so I think that my strong urging them to, again, partner with the nurses is really, really key. Also in the book, I looked up some websites for all, again, because this isn't just about cancer caregiving, but what are websites that they can refer to where they very specifically have family education tools. And I recommend that they go to the NIH centers for the most timely information, whether it be about a treatment or a medication or some other kind of therapy. So there's a list of the NIH centers specifically where they can find information that is targeting family caregivers' needs. So hopefully that will be a good resource for caregivers.
Thank you. I really, really like that you have put into the book the little exercises for them. I think it's a great way for, like you said, for them to normalize what is going on, but it's also a way for them to reflect and take care of themselves through this as well, because that compassion fatigue that happens for nurses also ends up happening for those caregivers. And what a great opportunity for them to be able to take the time to look at how they're also dealing with the situation. I really like that about what you did with the book. I wanted to ask you, are there any other resources for the nurse that you could suggest to learn more about caregivers or what we can do to help them?
Well, I know there is Putting Evidence into Practice, ONS book, an assimilation of the literature on caregiver burden and strain. That, to me, would be the go-to source where there is the most recent evidence outlined as to what will help. I would make that the number one stop in terms of nurses looking at what's in the literature and what is the significance of that research findings out there. And I'm keep trying to champion also a lot of continuing education about what are the needs of family caregivers. I think we can do a better job at that at our large education meetings to keep. And I think this issue is significant enough that I think it should be a recurring theme, whether it be at a virtual Congress or hopefully the way we used to attend Congress in the past. But I think this needs to be upfront and very visible in terms of recognizing that we have to keep our eye out in terms of what's available. And I think there's possibilities of translating what other specialties are doing into the cancer field. And the best example I can think of is in the case of Alzheimer's. Family-centered care and resources within that specialty are very applicable for many of our family caregivers. And there's respite care for family caregivers. There's a magnitude of support groups, and there's a lot of funding out there to support that. But I think also to remember, don't just look at what we have in front of us, but look to other specialties as well. There's information out there on heart failure and supporting families where someone has heart failure. So we can learn a lot from these translational implications of family caregiving in a whole host of chronic illnesses. So I would encourage us to keep our eyes open for some of that literature as well.
That is a really good idea. I think it is really good when we can look at what our colleagues are doing and see the, kind of the ideas that they have. They might have something different than we haven't thought of, but that would work very well for our situation as well. I have two questions I want to kind of end with. The first one is, what's something about caregivers that isn't often mentioned, but you wish nurses knew more about?
Well, you alluded to it a little bit ago, Steph, and that is that many of the caregivers put their own health on the back burner. And when they compare what's going on with them, especially if it's a catastrophic illness of their loved one, they diminish their healthcare needs. And so there's quite a bit of evidence in the literature. And I have also integrated into my references in the book, professional references as well as others to look at the concern about the compromise in health of the caregivers, whether it be that they're not attending to their own needs or the wear and tear on them as a result of the constant caregiving. So the other thing that I think is very important are the children in the family, whether it be in the immediate family, whether it be a grandchild, whether it be a child who's very close to an uncle who is very ill. Similarly, we make the assumption that just because they're not talking, it means they're doing okay. And think for a minute about us as adults. We have a hard time sharing our feelings. And children do not have the same capacity as we do as adults. But I find they oftentimes are really, their needs are ignored. And so we need to be the one to say, are you worried about how grandpa's doing? Or many times it may be a teacher who's saying, he seems very distracted, which isn't like him or whatever. So just keep an eye out on the children and know that even though they may not be talking, they're sensing what's going on in the family. They can tell that things are not the same as they used to be. So remember the children. And I think the other thing is it really does take a team. It's unrealistic to expect that one person can assume all these roles, and to encourage the family member to take up people who offer to help. I often say, this is a gift you're giving them. People that don't want to help are not going to ask what they can do. But the people that do say, I want to help, let them help. They truly do want to do it. And in that regard, the other aspect is we cope with illness when it happens as we've coped with other crises in the past. So people aren't going to change the way they cope. So if I'm a talker, before this happens, I'm going to want to talk about it. So looking at what the norm is, and that's often what we should expect, not only for the patient, but the caregiver as well. We expect so much of them, and I think we need to flip-flop our awareness that they're the ones who are doing the majority of the care, not us. We are sort of an episodic visitor to their domain. And I think that we need to acknowledge the strain that they have, bring it up to them. If we see that they, are looking stressed or whatever, or ask them, just as we ask the patient, how are things going? And when you acknowledge the concerns that they may be having, you're opening the door for them to be able to share with you some things that they may not ordinarily share in the absence of you talking to them as a concerned nurse for their care as well.
That's perfect. This has been wonderful. I think that you really have shown your passion for caregivers and just how we as nurses can help them and how we can be better attuned to what their needs are. Are there any final comments that you might have?
No, I think we've given a pretty good snapshot, of this landscape of family caregiving.
Oh, wonderful. Well, I, for one, am very excited to read this book and be able to see the love and work that you put into this for oncology nurses and nurses, in general out there for their patients and their caregivers. So thank you very much for sharing with us today.
Thank you for letting me have this time with you.
You're welcome. You have a great day.
Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.